Cat's blood work just came back. So now what? Your veterinarian may have mentioned elevated kidney values or follow-up, and you may be feeling overwhelmed. What do these numbers actually mean? And more importantly, what can you do with this information? Today I'm diving deep into your cat's lab results, breaking down what the most important values tell you, how often to check them, and what additional tests can reveal about your cat's health. If you're new here, welcome! I'm Dr. Emily, and this channel is dedicated to helping you take the best care of your senior kitty. Make sure to hit that subscribe button so that you don't miss a thing, and like and share the videos so I can create more content like it. If you've ever stared at a vet report full of numbers and abbreviations, this video will help you make sense of it all. So let's get started. There's a list of what we call basic lab values that tell us something about the health of the kidney. These values include things like the BUN, the creatinine, phosphorus, potassium, and so on. Let's start with the BUN. Stands for blood urea nitrogen. This is a blood value that comes from buildup of protein metabolism. So essentially when food is broken down in the gut, this is a blood value that tends to correlate with that. It's not 100% specific to the kidneys. It can be affected by other things like GI disease, high protein meals, dehydration, but it is one value that we look at in correlation with something called a creatinine. The creatinine is more kidney specific, and when the creatinine and the BUN rise together, it causes something labeled azotemia. That azotemia is what flags us to go, there might be something wrong with the kidneys. We should dig deeper into this. The BUN value can get pretty darn high before it actually affects how your cat feels, versus the creatinine doesn't have to change a whole lot sometimes to make your cat feel crummy. Then there's the phosphorus. This again is basically a byproduct of digestion. So when your cat eats food, the phosphate in it is absorbed into the bloodstream, and that is what we see in the blood values. We know that a high phosphate level long term will injure the kidneys. It'll also make your cat feel really icky. The higher the phosphorus level is in the bloodstream, the higher their chances that your cat is not eating. Another basic value is potassium. Potassium is a major player in muscle function. So if your cat's potassium level is low, they'll absolutely feel weak. And this can show up as a cat that's dragging its rear legs around, it can't jump properly, it's just weak and tired. On the flip side, we don't want a high potassium either, although it's more common with our typical stages of chronic kidney disease for this potassium to go low than it is high. Albumin is a specific protein in the blood. This one we tend to look at with kidney disease, even though it's not 100% specific to the kidneys. If it gets too low, it will lead to what's called third spacing of fluid. Meaning if there isn't enough albumin in the bloodstream to keep the blood in the bloodstream, we'll have fluid accumulating in the chest or in the abdominal cavity or the belly. Albumin levels need to remain normal. If a complete blood count is run, we want to look at the white blood cell count to screen for any sources of infection or inflammation, although it's not only specific to that. So that's something else to keep in mind when we're looking at blood work, is when I say one value and what it may or may not mean, just understand that there is a long list of other things that it can correlate with. So if we have a white blood cell count that's high, we could be thinking infection, we could be thinking inflammation, we could also be thinking cancer, and our next go-to is what type of white blood cell is high. So please understand that even though I'm giving you some basic information on these lab values, no lab value is looked at in a vacuum. They are looked at in relation to each other. So we look at that white blood cell count. We also look at red blood cell counts. Cats that have chronic kidney disease are more prone to anemia. So we want to make sure that hematocrit/PCV/red blood cell is in the normal range. If it's trending down, ideally we figure out why and we treat it, or sometimes we just choose to monitor it if it's not terribly low. But we do know that anemia makes cats, again, feel crummy. If a urinalysis or a urine sample was run, we want to know what the specific gravity is. That tells us how well the kidneys are concentrating the urine. So how well are they pulling water back into the body rather than excreting it out in the urine? Cats with chronic kidney disease tend to have low specific gravities, meaning they lose a lot of water in their urine. And that's why if you look, their urine doesn't look like urine anymore. It doesn't smell like urine. It looks more like water. That can correlate with the specific gravity number. We also want to look to see if there is protein in that urine sample, and ideally run what's called a urine protein to creatinine ratio. This is an exact number that tells us how much protein is being lost in the urine or how much protein is being excreted in the urine. Versus on screening urinalysis tests, we get a positive or a negative or a multiple positive or some random number that's based on a color changing strip. That routine protein number on a urinalysis isn't nearly as helpful as that urine protein to creatinine number. In the urinalysis, we can also look for white blood cells there, and we can look for red blood cells as well, indicating, again, infection, inflammation. Should we be diving deeper into this information? These are kind of the basic values we look at when we know we have a cat in chronic kidney disease, or we have a cat that we're trying to stage into chronic kidney disease, or we have blood values that change and raise that red flag of, do we need to be monitoring this cat? Do we need to be staging them as a cat with chronic kidney disease? These core values provide the first clue about kidney health, but they don't tell us everything. They typically allow us to do what's called International Renal Inter-Society staging, and this staging provides us with management tips and a guideline on rechecks. So for that question on how often should you be rechecking lab works, again, this is a very general guideline, but a good starting point for most of our cats. If they are early stage chronic kidney disease, meaning stage 1 to 2, generally we're looking at these lab results about every 6 months, depending on how stable or unstable they are. Once they cross into that moderate chronic kidney disease, meaning about stage 3, we usually want to see these lab results about every 3 months. And if they're more advanced, chronic kidney disease stage 4, then sometimes we're checking them every month or every 2 months, again, depending on how stable your particular cat is and what we're trying to monitor. Regular monitoring helps us catch changes quickly, adjust management plans, and keep your cat feeling the best they can. Beyond the basic tests, we also have more advanced or optional tests that give us deeper insights. Things like blood pressures, abdominal ultrasounds, abdominal x-rays, and some additional advanced blood and urine tests. One that's becoming more and more common on so-called routine blood screens is something called an SDMA. This is proprietary technology to a specific lab in the United States called IDEXX. The SDMA, in theory, is more specific to kidney health itself and elevates before that BUN and creatinine value are going to go up. It provides a faster insight so that we look at the kidneys a little bit harder if it's changing. Another value worth looking at, particularly if your cat's screening calcium is high or borderline high, is something called an ionized calcium. The ionized calcium is very specific to what your cat's actual calcium level is in the blood. Calcium's a tricky thing. It jumps in and out of the blood and it jumps in and out of the bone, so oftentimes our screening blood value isn't as accurate as this ionized calcium version. If the ionized calcium is high, not only can it damage the kidneys further, but sometimes it does make us look into whether or not cancer is an option in this disease process as well. Or high elevated calciums can also be an indication of something called parathyroid disease. Regardless, the body doesn't really like the calcium level to be high, so it's worth knowing if it is so that we can change our management strategies. There's also newer blood values called a cystatin B and the FGF23. These tests don't need to be run on every cat with kidney disease, but depending on what your cat is doing, depending on what their disease process looks like, they may provide us with additional information about injury, inflammation, phosphorus levels, things of that type. Screening blood pressures are very important numbers. Blood pressure in a clinical setting can be as much as an art as it is a science, for that matter in the home setting as well, but it's something that we need to be trending. One single blood pressure value isn't really helpful. We need to know what the trend of that blood pressure is so that we know if this is high, we need to start medicating for it because high blood flow or high blood pressure to the kidneys will also cause further damage. Another blood test that again is not specific to kidney disease but may be helpful is something called a pro-BNP. This is a value that measures stretch on the heart. So why is this important with our kidney disease cats? Well, it's important if you need to be using subcutaneous fluids to keep them hydrated. We want to know if there's any heart disease present because subcutaneous fluids can absolutely make that worse. It's also important to know if this value is elevated, that could be contributing to the azotemia I mentioned earlier, that BUN and creatinine value. Those can climb if we have heart disease present. So it's important not to label a cat with chronic kidney disease if we haven't looked at the other possible causes of that azotemia, the BUN and creatinine values climbing. The proBNP can give us a little bit more insight into that scenario. And another blood test that can give us a little bit more information into other scenarios that will cause azotemia is either something called an FPL or PSL, depending on the lab that's being used to run this blood work. This is a screening test for pancreatitis, and while it's not 100% accurate, if it's elevated, it could indicate pancreatitis. It can indicate GI inflammation. It could be another reason why your cat's BUN and creatinine are climbing rather than just primary chronic kidney disease. So if you haven't figured it out by now, it's important not to just look at the BUN and creatinine, say they're high, this is the stage of chronic kidney disease my cat has, and 100% blame it on those two values. We need to look at all of the values, we need to look at the clinical picture, and we need to look at some of these other numbers to make sure there isn't a secondary or primary disease process causing that azotemia that we're seeing. And as I had mentioned, abdominal x-rays and abdominal ultrasound can also be very helpful. Abdominal x-rays, particularly if we're looking for kidney stones or bladder stones or ureter stones. Abdominal ultrasound, not only to look at the structure of the kidneys and confirm, yes, this is more of a chronic kidney disease process, or is this actually an infection in the kidneys? Is this some sort of mass in the kidneys? Do we have pancreatitis and gut disease that's affecting the kidneys? An abdominal ultrasound can give us a much better overall picture into what may be going on in the belly so that we can put all of the puzzle pieces together and come up with a really accurate management strategy. I know it's easier said than done, but if your cat has been diagnosed with chronic kidney disease, it's so important not to panic. You're headed down the right path by learning about these lab values. Next, you want to review these lab values with your veterinarian and make sure you ask about trends, not just single numbers. One random single number tells you absolutely nothing about your cat's health, kidney or otherwise. You want to make adjustments as needed to nutrition, to hydration, to supplements, to medications. These values help guide those decisions, and you want to stay proactive. Definitely come up with that recheck schedule that fits the situation, that fits your schedule, and obviously that fits the budget as well. Understanding lab values really is a game changer for managing chronic kidney disease. It's an important part of creating a step-by-step management plan. And hopefully this video has given you some insight into what we're looking for and what you should be looking for and what we can do with this information. If you found this video helpful, share it with other cat caretakers. Let's get this information out there. And let me know in the comments below what part of lab work is most confusing to you. I can either answer questions directly below or maybe even create a secondary video to address your concerns.